Why injured runners need lifestyle medicine than a new pair of running shoes. If you're tired of recurring running injuries or nagging pains and aches that keep coming back, this might be the piece that you're missing, right? A new pair of running shoes is not going to get rid of that knee pain or that IT band, hip pain, Achilles tendonitis. So I'm Dr. Ray Peralta, physical therapist and run coach, and over the past 10 years, I've helped hundreds of runners hit PRs without pain using an approach most people overlook: healthy lifestyle habits, lifestyle medicine. In this video, I'm going to share what lifestyle medicine actually is, why it matters for runners and injured athletes, and the four biggest myths that are stopping people from using it effectively. And stick around because I'll show you exactly how to apply this even if you're currently dealing with an injury. And if you're running looking to stay injury free, or just you're currently in pain and you want to get pain free, check out my free training, a link in the bio to learn more. So, more than 80% of runners get hurt each year. And also, more than 80% of US healthcare spending goes towards treating preventable conditions, whether it's orthopedic, running related, like orthopedic injuries, whether it's knee pain, back pain, etc., or things like that are related to poor lifestyle habits such as obesity, heart disease, diabetes. Uh, Things like heart disease and diabetes cause different issues. Obviously, heart disease can cause heart attacks or strokes, which kill about 41 million people each year. That's 71% of all deaths is just through to these, poor lifestyle habits that then becomes diseases. So, lifestyle medicine is a evidence-based approach that uses six key pillars. One, it's a whole foods plant-based nutrition, a regular physical activity, right? If you already run, that's great. But oftentimes you're already getting some regular activity just with your running. A restorative sleep, stress management, avoidance of risky substances, and positive social connections. For runners, especially injured ones, this isn't just about prevention, it's about performance, pain reduction, and long-term health. So, myth number one, lifestyle medicine isn't as effective as traditional medicine, right? You might be thinking, hey, I'm just going to go to the doctor, get some pain pills, or get an injection, and that's just going to help me, right? It oftentimes just masks the symptoms. See, the truth is, lifestyle changes can actually help you get rid of running related aches and pains altogether. I've seen this myself as a physical therapist, using the right exercises, postures, helping them just live healthy habits. That oftentimes many of my patients are able to get rid of pain, get off the medications, get relief when injections don't even work, even avoid surgery. And it can also help people reverse things like type 2 diabetes, heart disease, and obesity. So I had a patient in her 60s with bone-on-bone arthritis. Through structured exercise, weight loss, and stress management, she was able to avoid total knee replacement surgery. And she went from being barely able to walk to now she was able to go on nice run walks pain-free. So it's possible to, again, avoid the injections, the medications, the pills, and everything with the right lifestyle habits. And now you may think, like, but I'm a runner. I already exercise. Oftentimes, runners don't do the other types of exercise like strength and mobility. And when you incorporate that, in addition to also healthy lifestyle habits, you're oftentimes able to make big changes and finally overcome that nagging, recurring injury or pain. Myth number two, it's just about diet and exercise. So people think, oh, I already exercise, I do some running, I do some strength training, I eat healthy, healthy enough, right? But the thing is, sleep, stress management, and social support matter just as much. I've coached many runners who trained and ate well. The heck, they maybe even eat like a lot of plant-based foods, but often they neglect sleep. And once they committed to getting at least 7 hours of sleep a night on a consistent basis, not just doing it some nights and then the weekends dropping off, they finally are able to recover from their knee pain. I know it sounds crazy, right? You just need to sleep enough hours, but you have to do it consistently. The same bedtime, the same wake time. Like if you want to get up at 5 a.m. and try to get to bed by 10 p.m. so you get 7 hours of sleep a night. And when they finally stayed consistent with that, not just for a week or two, but like for a couple months, finally the physical therapy was actually able to work better because now they're not so sleep deprived. And now they're also able, the nutrition was able to work better for them too, because now they're able to lose weight properly because oftentimes they were still overeating because they were sleep deprived. And now they're able to finally, fulfill their dream of be able to run pain free and then train for a marathon. Myth number three, lifestyle medicine is just new age stuff. This is just some new age stuff, these influencers are just making up. However, it's an ancient medicine. Actually, it's come from the times of Hippocrates, right? It said, let food be thy medicine. I've seen chronic back pain and myself and also my patients just resolve without pills, just with constant, the right types of stretches, mobility work, ergonomic workstations, right? Making sure they have like a standing desk for their, if they have a desk job instead of sitting all day, and just doing proper strength exercises. They're able to get rid of back pain that they had for years, and also stress management, because sometimes their stress was causing the muscles in their back to spasm out. So they would have managed the stress, do mindful practices, breathing exercises, and the problem is that many people rather just pop an Advil than do the daily rehab, do the work, do the ergonomic changes. But those who commit to the healthy lifestyle changes are able to get off the medications altogether and get rid of things like chronic back pain. When in the past they thought they were gonna have to live with it forever, they just had to be consistent with the daily work. Again, good posture, using that the stand desk, doing the right exercise, the right stretching. It's totally possible. You just have to stay consistent with it. Myth number 4, it's a quick fix. And this is where I come back to consistency, right? Real change takes time. So I had a woman a couple years back who came to me in physical therapy. She was in her 30s with chronic hip pain. She goes, "Oh, I tried this anti-inflammatory plant-based diet, but my pain's still sticking around. Why is this not working for me? And I already do some exercise. I do Pilates, etc. But I want to get back to training, but I'm still not able to do it." And then when we dug deeper, she was still binge drinking on the weekends and only sleeping 4 hours a night, 5 hours a night. And we had like a heart-to-heart conversation that if you really want to get the benefits of lifestyle medicine, you just can't partially or half-ass the stuff that you're doing. You have to really commit to the process, and then your body can actually heal. Because how are you going to heal sleeping 5 hours a night and then binge drinking alcohol, right? So once she committed to sleeping, at least 7 hours a night, cut out the alcohol, right? Because she tried moderation, but oftentimes she would slip and start binge drinking again. She had to eliminate the alcohol, right? And then in 6 months, she was finally able to actually fully recover, right? It wasn't just about just doing the exercise or hoping for a quick fix, like, oh, I'm just going to quickly do something. It was about doing these things consistently and sticking with it for long enough period of time to actually see results. So she did that for 6 months, and now she was back to running half marathons pain free. So whether you're injured or not, this is how to apply the 6 pillars as a runner. 1, physical activity. Aim for 150 plus minutes per week of aerobic activity. So if you already run, that might look like 3 days of running per week plus 2 days of brisk walking, right? So you'll get, 30 minutes, 5 days a week, or a combination of running and walking. You'll get your 150 minutes. Easy peasy. And if you're injured and you can't run, you could substitute a running or walking for cycling, right? So hop on a stationary bike. Many times runners with injuries of the lower body can often tolerate biking. Oftentimes it's low impact, less stress on the joints. They often bike, do that 30 minutes, 5 days a week, and you get your 150 minutes of aerobic activity. And also strength training 2 times a week. If you're already dealing with injury, obviously work with a physical therapist. But if you're not injured, right, do things like squats, deadlifts, calf raises, lunges, push-ups, full body routine twice a week. It's going to do you wonders. Nutrition, make sure to eat mostly whole plant-based foods. Now, you don't have to be completely vegan or vegetarian, but I'd still recommend having a majority of your plate with lots of vegetables, healthy grains, etc., and minimize overconsumption of processed foods. You may want to consider like a Mediterranean diet. Maybe enjoy that. Maybe have some seafood. And again, you still want to minimize processed foods, minimize alcohol. I say if you can, eliminate alcohol altogether, but I understand some people just enjoy it, but try to really minimize your drinking. So if you're a man, that's limited to just 2 drinks or less, and then you're a woman, 1 drink or obviously 0. And then don't do that. Don't be drinking 7 days a week either. I mean, I would try to limit drinking to just 1 or 2 days a week. Really try to limit your drinking, because it does add up. Because even if you try to drink in moderation, but if you're doing it 7 days a week, or if you're doing 2 drinks a day, 7 days a week, that's 14 drinks in a week. That's still going to put you right next to the heavy drinker category. So you still also don't want to be drinking on a daily basis. So when you do these dietary changes with nutrition, right, plant-based foods, healthy, limiting the processed foods, right, the MSG, these preservatives in the food, you can actually reduce pain and inflammation. I've seen this happen multiple times. Sleep, make sure you're sleeping at least 7 hours a night. Keep a consistent bedtime, even on the weekends. Recovery happens when you sleep, not when you scroll TikTok at night or Instagram. Stress management, try meditation, breathing exercise, or yoga. 5 minutes a day is enough to start. Lowers your cholesterol, improves immune function, and reduces your injury risk. Again, avoid risky substances, obviously drugs and alcohol. And I say alcohol here because it's more the thing I see a lot of runners. Not that many runners smoke. Yes, there are some who smoke. Obviously, I also recommend cutting out smoking, but many of them will use alcohol as like a social activity. Oh, after run club, we're gonna go grab a beer or some wine. However, I would still really emphasize try to do other social activities that don't always revolve around alcohol. Right, alcohol impairs your sleep, recovery, and mental health. Right, you actually be more anxious and stressed because you keep drinking, even though you think you're drinking a healthy amount. Right, they're like, oh, I'm only drinking 2 drinks 4 days a week. Right now, I'm drinking 8 drinks in a week. That still can be a lot. Depending on your size and frame, that could still put you in the heavy drinker category. So really try to minimize the drinking or eliminate it altogether. And then social connection, right? Join a run club or community. Spend time with friends and family who lift you up, because social connection can actually help you reduce stress and even help you recover from injury. Sometimes when you're in isolation, you're alone with an injury and you're feeling depressed. Just having some support network, friends and family can help boost up your mood and lift you up. Right, strong social ties also help reduce injury risk and can improve your performance. You ever notice that you run better in a group? It's because that group oftentimes motivates you. Obviously, you need to find the right group that you vibe with. So, if you want to run pain free and finally break the injury cycle, watch my free training, the link in my description. And so, I'll show you how to apply this to your running and your life.